Mastering Implementation Science, from Theory to Real-World Impact. Welcome back to the channel. Today, we're diving deep into the heart of implementation science and exploring how we can turn theory into real-world impact. If you're a medical or health researcher, mastering implementation science is critical to ensure that your research moves beyond the lab or the journal and makes a difference where it truly matters in practice. So, what exactly is implementation science? In simple terms, it's the study of how to effectively integrate evidence-based interventions into healthcare, public health, and policy. While traditional research focuses on developing new interventions, implementation science focuses on the how do we get these interventions into the hands of practitioners and make them work in real-world settings. It's all about bridging research and practice. Theories and models help us understand the best strategies for implementation, but at the core, it's about making research actionable, scalable, and sustainable. To master implementation science, you need to get familiar with some of the key theories and models that guide this field. Let's briefly touch on a few. 1. CFIR Consolidated Framework for Implementation Research. This comprehensive framework helps you assess the factors that influence implementation across multiple domains, from the intervention itself to the inner and outer setting. 2. REAIM Framework. This model focuses on 5 critical dimensions: reach, effectiveness, adoption, implementation, and maintenance to evaluate public health interventions. 3. Knowledge to Action KTA Framework. The KTA framework provides a practical guide for moving knowledge into practice, emphasizing the cyclical process of knowledge creation and application. These frameworks are your roadmaps. They guide you through the complexities of implementation, helping you identify the barriers and facilitators that can make or break your efforts in real-world settings. Now, let's break down how you can move from theory to real-world impact. Here are the key steps to master implementation science in your work. 1. Assess the context. Understand the setting in which you plan to implement your intervention. What are the needs, resources, and challenges of this environment? 2. Engage stakeholders. Early engagement with key stakeholders such as healthcare providers, community leaders, and patients is critical. Their insights can help shape the implementation process and ensure buy-in. 3. Choose your framework. Depending on your specific goals and context, select a framework that aligns with your implementation objectives. This will provide structure and guide your evaluation. 4. Pilot and adapt. Before scaling up, start with a pilot. This allows you to identify potential issues and adapt the intervention to fit the context better. Flexibility is key in real-world settings. 5. Measure and evaluate. Continuously assess both the implementation process and the outcomes. Are you achieving the desired impact? If not, what adjustments are needed? Remember, implementation is an iterative process. Success often requires adapting along the way. Don't be afraid to make changes if things aren't working as planned. That's a normal part of implementation science. Like any research field, implementation science has its challenges. Here are some common pitfalls and tips on how to avoid them. 1. Ignoring context. A one-size-fits-all approach rarely works. Always tailor your intervention to the specific setting. 2. Limited stakeholder engagement. Lack of stakeholder involvement can lead to resistance or failure. Engage them from the start to co-create the implementation plan. 3. Neglecting sustainability. Don't just focus on initial implementation. Plan for long-term sustainability to ensure your intervention remains effective over time. By being mindful of these challenges and actively addressing them, you can significantly increase the likelihood of success in your implementation efforts. In conclusion, mastering implementation science is your key to making a real-world impact with your research. It's not just about understanding theories and models, it's about applying them to create meaningful, lasting change in healthcare and public health. So, as you move forward in your research career, remember to integrate implementation science into your work. It's the bridge that takes your findings from theory to practice, making a tangible difference in the world. Thanks for joining me today. If you enjoyed this video, don't forget to hit that subscribe button for more insights on implementation science, epidemiology, and everything in between. Let's continue mastering the science of implementation together. See you in the next video.